everybody. I'm Dr. Bhavya Bayana, Consultant Surgical Oncologist, Sri Pooja Multi-Speciality Hospital, Habsiguda. So, I'll be doing a few cancer awareness videos in this session. So, generally being cancer specialist, what we do is we allot a month to each cancer, for each cancer's awareness. So, in this year, January is generally the beginning of the year is given to a very important cancer, that is cervical cancer awareness. So, cervical cancer awareness month is January. In this month, we try to focus on cervical cancer symptoms and all. So, I'll be discussing about cervical cancer awareness today, as it is January. So, I'll be discussing the very basic points and few very important points which are to be remembered. So, I'll not be giving a finer details. So, cervical cancer, what is cervix? That is very important thing which many of you might be confused. There's vagina, that is the introitus, and then above that there's uterus. Uterus is the womb where, so womb has a structure, entry point. That small part is called cervix. It's about 3 to 4 centimeters, and that small part has a lot of cancers. It is the second most commonest cancer in women in India in the present scenario. So it is very important to know about the symptoms. So how does it present? That is very important. And which age? It generally presents around 40 to 50-year-old females, and it is the way it presents, the symptoms are very important which are to be noted. One is postmenopausal bleeding. What is postmenopausal bleeding? Menopause is when once a female attains a certain age, her period stops completely. So once they stop for around a year, you're supposed to enter a menopausal period. So once your periods are not there for a year, and then you have some, after 4 or 5 years, you have sudden small spotting, small bleeding, which this has to be taken very seriously. Any amount of bleeding, even a small drop or a significant amount of bleeding, is very important in the postmenopausal period. That is, once you have no periods for a year and then you have some spotting or some bleeding after a few years, that is a very significant thing which has to be completely evaluated. There will be some reason which is found out. This is one. And the next thing is white discharge. White discharge routinely is a common thing, which is a physiological thing which can happen to a lot of females during menstruation, during pregnancy, during different parts of the cycle. There are different white discharges. But the white discharge character generally, normally will be very thin and very watery like. But once it is thick, curdy and foul smelling, and you have white discharge for a prolonged period of time and the quantity is very high, this is the time you have to be aware and get it checked. White discharge can also be a presenting symptom of cervical cancer. And the other symptoms are lower back pain, lower belly pain. These are vague symptoms. So these are generally in the postmenopausal period. In people with premenopausal, that is before your menopause, what are the symptoms? So you get your cycles routinely, your cycles, let us say they're 28-day cycle or 30-day cycle. So if you have heavy cycles, in general, you might be getting cycle for 3 to 5 days. Or sometimes the cycle gets prolonged, 10 days, 15 days. And sometimes there can be intermenstrual bleeding. You have your date somewhere 15 days back and you're supposed to get 15 days later, and in between the periods you have bleeding. This is also a symptom of cervical cancer. So this is how you have to see intermenstrual bleeding might be there. And the other thing is coitus, post-coital bleeding. So you have sex and then after sex there might be little bleeding, which is post-coital bleeding. That can also indicate cervical cancer. And there might be sometimes post-coital pain. You have sex and then there's pain, abnormal pain, which is generally you do not have before. This is also something which has to be taken care of. These are the early symptoms of cervical cancer, which you have to keep in mind. And advanced symptoms are like you have urinary disturbances and then you have other issues. But this is the stage where you have to present to a doctor. Postmenopausal bleeding, abnormal bleeding, white discharge, post-coital pain or post-coital bleeding. This has to be kept in mind. So these are the symptoms. And then once the symptoms are there, so who is a person who is more prone to cervical cancer? It can happen to anybody, but there are some people with high risk. High risk symptoms are people who have a very bad hygiene. So vaginal hygiene is very important. So hygiene is the people with bad hygiene can be more susceptible to cervical cancer. And people with smoking habit. Smoking can also increase your risk of cervical cancer. And one of the most important thing is unsafe sex practices. It is always ideal to limit the number of sex partners and also use barrier method whenever you're having a sexual intercourse. So, as you know, contraceptive pills and all can prevent you from getting pregnant, but they cannot prevent from getting infections. So, cervical cancer, the cause can be an infection. That is the most important thing. So, cervical cancer, how is it caused now? What are the causes? Causes can be a very simple infection, that is a human papillomavirus (HPV) infection. So this infection can occur to anybody at any age, and generally what happens is when you have a good immune response, the virus is killed, just like a cold or something, your virus gets killed. But in some people, the virus is stable, and then it becomes a chronic inflammation, and then it causes chronic changes which can lead to cervical cancer. So this is where the sexual practices like barrier method and all come to protection. And this virus, some viruses are high risk viruses. They cause the cancer. Other viruses can just cause parts. So since we know that it's a viral infection, this is the only cancer which can be prevented. If you ask me to say one cancer which can be prevented, that is cervical cancer. The answer is cervical cancer. And how do we prevent it? It is a very important question. Cervical cancer has vaccination. Vaccination can be done right from the age of 9 years. Why we say 9 years is because we want you to get vaccinated and be immune before the virus attacks you. So the virus enters through sexual intercourse. So we want you to be immune even before your sexual intercourse. So we target girls around 9 years and give vaccinations. Nowadays, even this vaccination is even included in the national immunization program. So if you're from 9 to 14-year-old, that vaccination, you have 2 doses of vaccination. Your immunity is very good and you get 2 doses of vaccination. Once you're 14 and 26, between 14 and 26, we give you 3 vaccinations, 3 doses of vaccination. If you ask me, once you're 26-year-old and then still you want to get vaccinated once you're before 45, it's up to you. It's a personal choice. There is no proven evidence that it is effective as when you get it done before your first sexual intercourse. So after 26 years, it's a personal choice. If you don't have any allergies, there is no harm in getting a vaccination done. These vaccines, you have 2 varieties. One is Cervarix and one is Gardasil. So Cervarix vaccine has two strains of viruses. As I said, high-risk viruses like 16 and 18 can cause cancers. Cervarix has these two, and Gardasil has, in addition to these two, 6 and 11. So they cause anal warts. Both are equally effective for a cancer prevention. They cost around 2 to 3,000 per each session, each vaccination shot. If you cannot afford this 2 to 3,000, there is a new vaccine by Bharat Biotech, which is called Cervavac vaccine, which is available at around 200 rupees. It's a very cheap vaccine and very effective. So all of you can get immunized by a Cervavac vaccine depending on the affordability. But vaccination before 26 years is a must nowadays. Don't be afraid that this vaccine can cause infection, because this is not a live virus and it is proven to be very effective and not harmful. Coming to the vaccination, once we are done with vaccination, another unique point about cervical cancer is the period it gives us. So what happens is, once you get infected with virus, it takes around 10 to 20 years to become cancer. In these 10 to 20 years, there are some changes, pre-invasive cancer changes. Lot of changes can happen. These changes can be picked up by us. When we pick up these stages in an early stage, we can even prevent it from going to cancer. So the amazing news is, cervical cancer can be prevented completely. When you detect in the pre-invasive stage, you can do simple procedures. Simple procedures are done, which are very, very easy OPD procedures. And based on that, cancer can be prevented completely. So what are the simple things which every female must do? So once you're 30 years and above, once you're married, you have your sexual intercourse and you're 30 years and above, you get a small pelvic examination done. It is an OPD procedure, very simple, very comfortable procedure, and it generally takes 1 to 2 minutes. It is a cytological examination. What we do is a cytological examination. In this examination, there are normal cells shed from your cervix every time. There are some cells which are coming down. So what we do is we just swipe around with a small brush and collect these cells which are shed down, and we examine them microscopically. Once we see under microscope, we'll know whether there is any pre-invasive stage or whether you are absolutely infection-free. And then based on that, we have some guidelines, which we'll be discussing later. And there's another test called HPV DNA test. So in the same way, we even check in the cells collected, we can check if you have any HPV high-risk viruses. If you have any high-risk viruses, we have a different protocol to follow. So if you're getting a pap smear done, which is a routine terminology used for cytological examination, once you're 30-year-old, you do it every 3 years. If you're getting a HPV DNA test done, once you're 30-year-old, you do it every 5 years. So 3 that and 5 this, you can choose whatever you want to do. Both are equally effective. HPV DNA test is a little costlier compared to a pap smear, routine pap smear. So this is how. One more important, very important point which has to be noted is, even people who have already been vaccinated, even though you're vaccinated, you have to keep continuing getting your screening done. Vaccination is just 70% effective in preventing cancers, but the remaining 30% is covered based on the screening. So everybody, though you're vaccinated or not vaccinated, you have to get a screening done. That is a must. So once the cervical cancer vaccination is done and the screening is done, what we do next is, if you're detected with cancer, what are the treatment options? This is where we are going to discuss the treatment options. Treatment options are based on the stage of the disease. Once you come to us, we diagnose, we take a small biopsy. That is, a tissue sample is taken and sent for analysis, where we confirm whether you have cancer or not. And then we do imaging. We do get an MRI where we see how is the extent, whether the other organs are involved or not. Based on different stages, you have different protocols to evaluate whether there is any spread or not. And then based on that, generally in stage 1, a simple surgery is all that you need to get a cancer eradicated. And you don't need any other treatment, no radiation, no chemotherapy, nothing. Just a surgery is enough. That is the importance of detecting a cancer in an early stage, because the treatment is very limited and the response to treatment is great and the financial burden is low. So the treatment duration is low. Once you're in second stage, we decide whether to go ahead with radiation or surgery based on the findings. Sometimes only radiation is enough. Radiation will cure most of the people completely in stage 2. But sometimes when the radiation is not effective, we go back to surgery and try to do both. Generally, in cervical cancer, we try to limit it to a single procedure, either radiation or surgery. That depends on the clinical presentation. But sometimes there are people who might need both the procedures together, and in advanced stages, when there is stage 4 cancer, you might even need chemotherapy. So this is regarding cervical cancer. The main problem which we encounter is not because people are not aware of all these, not because of people don't know that these are symptoms, but because of the taboo. Most of the females, most of our mothers, especially the elderly people, are not comfortable discussing their symptoms, that they have bleeding per vagina. They're especially not comfortable to discuss it with sons or son-in-laws, and they keep delaying till it isn't in a very advanced stage, till a stage where they cannot bear anymore. That is how long they drag. So it is better you go back to your parents and just ask a question, take a minute and find out if they have any symptoms which I have told, and get it evaluated immediately. So if you have any more questions about cervical cancer, please mention in the comment section. I'll try to get back as soon as possible. Thank you.